Right, so hit go, thank you. All right, good morning everybody. I'm here to provide an update on the COVID situation across the Murrumbidgee region. And today I am able to confirm that we have had another case of COVID-19 in our region that was identified in the numbers prior to 8 o'clock last night in the Hilltops region. And as we know, we have seen positive sewerage testing there over the last 3 sewerage testing. So a man in his 60s presented to the hospital at Young, and he has since been transferred to Wagga Wagga Base Hospital where he's being cared for. So we're currently looking to find the source of the infection, and our contact tracers are really working hard to identify anywhere that person has been to, so that we can undertake and get that list of venues, which we will be providing to you shortly. I think that's really, really important. There are other cases that are also under investigation as we go through and identify both casual and close contacts. So in our region, it has been quite an upheaval, a time of upheaval where we have seen quite a number of exposures, and that's been going on now for about the last month. So we do have venues up on our website in Albury where we have the other 2 cases that were announced yesterday, and also here in Wagga Wagga and in Young. So I really encourage everybody to make sure that you monitor those websites, and we have added 2 overnight. So that is the BP in Lavington and also the Cherry Blossom Motoring in Young. So we have the times available on the website, and anyone who has been at those venues is, at the times listed, are casual contact, and they should go into stay-at-home isolation and get tested as soon as possible. Stay at home until they receive a negative test. For people who are close contacts, our public health unit sends text messages out to those people, and they will receive a follow-up call with instructions on what they need to do. So the message really is now that we are in an environment of heightened risk, and the most important thing any of us can do is to understand that during this time we need to monitor ourselves for symptoms, and then we need to come forward early for testing. We can get on top of this if we identify new cases early and get them into isolation, and then that really, really slows down the transmission of the disease. So we have testing clinics available, and we've extended out right across our region, and of course we've got the drive-through here in Wagga Wagga, but we have stood up additional testing in Young at the town hall, and they will be there all over the weekend to make sure that we can get people tested between the hours of 10 and 4. Vaccination is also really, really important during this time. Vaccination helps to protect yourself as well as your community. And it's an important weekend this weekend. We're calling it Super Saturday and we're calling it Super Sunday. And we're running a range of clinics across our region where we will take walk-in people from vulnerable population groups, but specifically people who are non-English speaking and people who are from the Aboriginal communities. We really encourage those people to come forward in our super clinics, which will be held here in Wagga Wagga, Griffith and Young during this period. So vaccination is really important. We will be running over the coming weeks additional pop-up clinics where we see the need, where there are, again, populations that are vulnerable, where they have a lower vaccination rates, and we'll come in and do some additional clinics. There are over 100 locations where people across our region can get vaccinated, and the good news is now vaccination is actually open to anybody over the age of 12 years old. People can come forward. The messaging is much simpler now. Anyone over 12 should come forward and have a vaccination. So the other message is that our healthcare workers are progressing really, really well with their vaccination. It is really important that our staff are vaccinated to protect themselves as well as their community. And really, ever since the government started their rollout of the vaccination program in March, our healthcare workers have been very eager to come forward and have their vaccination. And we've had really great take-up of the vaccination. The public health order is very clear that all healthcare workers must be vaccinated and have their first dose by the 30th of September this month and have to be fully vaccinated by the 30th of November. So it is really important for all of the healthcare workers in the public hospital system, as well as healthcare workers that are in licensed private facilities. Ever since the rollout has begun, we have prioritised access to vaccine for healthcare workers and their families and their household contacts. So our healthcare workers have had really good opportunities to come forward and get their vaccination. And I'd like to thank all of the nurses and all of the clinicians and all of our staff across our region who have been so wonderful in coming forward. So I'll leave it there, and I'm happy to take questions while we await my colleague, Superintendent Bob Noble.
Just in relation to the Albury man or the XBT, we understand there may be other exposure sites linked to him, but he hasn't been cooperative. What's the situation? Is he isolating in home because of the report that he's in hospital? We have just shed some light on that situation.
So both of the Albury cases are in isolation and are working with our public health unit very cooperatively. Thank you. And we're continue to working with them to identify any other venues of concern that they may recall.
What's the condition of the man who reported to a hospital in Young but has since been transferred to Wagga Base Hospital?
So the man being cared for at Wagga Base Hospital is currently in a stable condition and we'll continue to care for him there.
Jill, what do we know about that man? Do we have his age, where he's from and how he got the virus in the first place?
So he's a 60-year-old person and the source of infection is currently being investigated by our public health unit, and we hope to get those venues of concerns to you in the next hour or so that we can post those and we can identify anyone who has been in those areas during this time and particularly identify who are casual contacts and who are close contacts.
Do you have any word on how contact tracing is going so far? Are we looking at quite an extensive list of venues, or do you have any idea of how many places this person might have been yet?
Well, look, we're still working through interviewing the person. Obviously that person is unwell, but the person is being very helpful in assisting us with identifying where they've been. And I think if you have a look at your own phone over a period of time, there are usually quite a number of venues that people have been in, and particularly with the lifting of some of the restrictions since last Saturday, it has given people an opportunity to get out and about more than they previously were.
On those venues, some of those exposure sites listed are more than 2 weeks old. Why has it taken so long for some of them to be added to the known contact case?
So the exposure sites are often from people who are under what we call surveillance testing. So they're people who are no longer in our region. So essential workers have to have surveillance COVID testing on a regular basis every 3 days, and sometimes then they are already, if they are asymptomatic, they're already progressed in their disease before they're diagnosed as positive. So that's how we sometimes get that lag period. But I just want to reassure people, as soon as we are advised around venues of concern, we get them out there into the public domain.
Those 3 cases under investigation, are they all in Young, and do they have links to that man in his 60s?
So we're still investigating all of the additional areas of concern and close contacts. So we'll be able to provide you with additional information once our contact tracers have done that.
With the news that Albury was going into a snap lockdown, there's been some concern among Wagga that this could be a future that awaits them. I guess what actions can our Wagga residents take to ensure that this doesn't happen?
Well, it's very important that everybody across our region takes the actions that I'm going to outline now. So clearly the first thing that we need to do is to really come forward for testing. Our testing numbers have been okay, but not great. And I think that people sometimes are getting a bit sick of going forward and having COVID tests, but your COVID test is only good for the day that you're tested. So if you had one last week and you get asymptomatic, you need to come forward and have another one. and we have increased the availability of COVID testing across the region. So getting people tested and into isolation is the single most important thing we can do to slow down the spread of the disease. Obviously, the other things are getting vaccinated to protect yourself and to protect your community, because again, we know that vaccination helps to reduce the severity of the illness if people become ill with COVID-19. Hence, that helps to slow down the spread of the disease, and importantly, helps to address the impact of COVID patients in the health system as well. And checking in with your QR codes, washing your hands and being very, very careful around your social distancing will all assist us in keeping our restrictions at the lowest possible level. Yeah.
Are there certain events that the MLHD have identified that would send our region back into lockdown, or is it just sort of managing the situation as it goes?
It is very much a fluid situation each day as we identify cases and whether or not they've been active in the community or not, and how long they've been symptomatic for. And health makes or provides advice to government, and then government makes the decisions about restrictions.
How likely would you say it is that there could be people in Young that have been that have had COVID undetected for a while?
Well, look, we're all, I guess it's not good to guess. We know there's been positive sewage testing there now for over a week, which was the alert that we knew that there was probably more than somebody just passing through. And now we have got that active case, and that person has come forward and is being cared for. We can assume that there has been some local transmission in the community, and the best thing we can do now is to get people coming forward for testing and identify any other cases.
I know you've spoken about the likelihood of any kind of lockdown measure in Wagga, but is there much discussion of it in Young specifically?
So that's a decision for the New South Wales government.
Just in regards to Albury cases, are we expecting any more cases to arise there, or any more exposure sites at the moment?
So we haven't had any further, apart from the one that I just read out, the BP at Lavington. There are no new venues that have come forward through interviewing our 2 cases there. So those cases, as I said before, are in isolation and are working with us and are progressing through the symptoms of their disease.
Have there been any close contacts of those Albury cases at all?
So anybody who has been identified as a close contact has been sent a message from our public health unit and will be receiving follow-up phone calls.
Jill, is there any update on any of those exposure sites, the testing results in terms of staff at those places or anything, the Albury case?
For the Albury case, do you mean staff in...
From the exposure sites, is there any update on the test results from them?
I don't have any information as regards to that, but I guess what we all need to do is to understand that when somebody is tested positive, that then comes into our numbers for the day. So we haven't had any new cases in Albury since 8 o'clock last night. So far, that's a good message.
And just another Albury question on that. What are the rules for people in Albury when they're travelling outside of the Albury LGA, say for work and such? Do they need to abide by those lockdown rules?
Yes, absolutely. So people should be abiding by the lockdown rules as of, and really right backdated to the 10th of September. They may only leave home for those valid reasons, to get food, compassionate reasons, to get medical care, or if they cannot get work from home or have education at home. And they really have to only go out for those reasons. They cannot, if they're out of the LGA, go anywhere else.
Yep, so if they were travelling outside of the region, say for essential work, and then,
they must abide by the stay-at-home rules as if they were in Albury, yes.
And just another question, apparently from the presser at 11 a.m. with the Premier, they're saying that another 3 household contacts of that Young case have since tested positive. Has that been confirmed? Has there been other cases that are linked to this one already?
Yeah, so as I said, there are 3 other cases that are associated with the Hilltops LGA that we're currently investigating.
And are they family members, household members? Do we know anything about them?
So I'm not able to say at this point in time until we get further details. Okay.